Well, good morning, everyone, and what an amazing group we have here with us today. I think it's important to know who each of the people are behind me. Maybe not the entire group of folks there. We'd be here all afternoon, but thank you all for being here. But we do have a number of speakers who are going to be behind me speaking as well today, because addiction has touched each person here in some way. Parents whose children were taken, families who've lost loved ones, and people in recovery with stories to tell about their own journey. To each of you, thank you so much for being here. I'm inspired by your courage to stand with us and to show your support. I'm also pleased to be joined by Alberta's Minister of Mental Health and Addiction, Dan Williams, Chief Cody Thomas of Enoch Cree Nation, and Dr. Rob Tanguay, Interim Senior Medical Lead of Compassionate Intervention for Recovery Alberta, who has an important role in today's announcement. And I want to say a special thank you to the mothers, Susan Boone and Janelle Watson, who will share their stories with us this morning. In the past 10 years, over 50,000 Canadian lives have been lost to drug overdoses. They are not just numbers. They are mothers, fathers, sons, daughters, nieces, nephews, aunts, and uncles, people who've been consumed by a wretched and unforgiving disease, a disease that seeks to inflict as much suffering as possible to both those afflicted and to their loved ones. Every person here today knows this suffering all too well, as do the hundreds of thousands of Canadians who've lost a loved one. We know that addiction is pain. It is a pain that no community has been able to escape. In our downtown cores, there are visible effects on every street, with individuals who have lost the ability to make healthy decisions, actively putting their lives at risk and causing fear and harm in the broader community. And more Alberta's rural communities are seeing the effects of addiction. Addiction is a daily anguish and heartache for family members, parents, and anyone watching a loved one be consumed by this awful disease. Right now, all of Canada is in the grip of this crisis, and we must do all we can to help Albertans who struggle with addiction. Since we first took office, mental health and addiction has been a top priority for our government. We found opportunities to expand treatment capacity, adding more than 10,000 new publicly funded mental health and addiction treatment spaces, which was a 55% increase in system capacity. We've removed barriers to service, helping to take the financial burden off families by eliminating the $40 per day user fees for publicly funded mental health and addiction treatment spaces, and covering the cost of the opioid agonist treatment drug Sublocade. We are building new facilities to support Albertans, including 11 recovery communities, 2 compassionate intervention centers, 3 live-in youth mental health treatment facilities, and the Northern Alberta Youth Recovery Centre. We've also expanded the Virtual Opioid Dependency Program, a world-leading program for Albertans to access proven addiction treatment medications with no cost and no wait list. I could go on, but I wanted to take a moment to extend my deepest thank you to all the organizations and Indigenous communities across the province that have partnered with us to develop the Alberta Recovery Model. The result of all of our work is a positive trend, with last year's opioid-related fatalities down 37% from the year before. This reduction in fatalities is 3 times larger than what British Columbia recorded in the same time frame. Despite this positive trend, too many of our friends and loved ones are still at risk of serious harm from their addiction or substance use. We know that there is still more work to do. There's more to do for individuals whose addiction has become so severe that they're in imminent danger to themselves and others. There's more to do for families with a loved one on the streets, dreading every phone call and every knock on the door. And there's more to do to bring back social order and ensure our province is a safe place for every Albertan to call home. We can't just sit back and wait for addiction to run its course and inflict its terrible toll in our communities. There is no compassion in leaving people to suffer in the throes of addiction, and we will not sacrifice our communities or give up on those suffering from addiction. Our government is 100% committed to helping those struggling with addiction in their pursuit of recovery, and that's why we promised Albertans that we would bring forward compassionate intervention as a tool to save lives. And today, we're delivering on that promise by introducing Bill 53, the Compassionate Intervention Act. This piece of legislation has been under development for some time because we recognize how important it is to get it right. The Compassionate Intervention Act creates an opportunity for families, guardians, healthcare professionals, police, or peace officers to take action when someone's addiction or substance use has made them a danger to themselves or others. Now, I do want to be clear, the Compassionate Intervention Act is not sweeping legislation that applies to every person who's dealing with addiction or substance use. It is only for the most serious cases where all other options have failed. It's important to remember that people in the clutches of addiction are unable to help themselves. The insidious power of addiction means the only thing that matters is their next high. It isn't a lifestyle choice. It's a treatable illness. And to families with loved ones suffering from addiction, compassionate intervention offers new hope. Hope that their loved ones can get the help that they need to break their addiction, connect with their families, and manage their life in recovery. With compassionate intervention, we have an opportunity to bring people who are suffering out of that state and give them back control of their lives. Thank you, and I'd now like to invite Minister Dan Williams to share more details.
Well, good morning, everybody, and especially to those joining behind us today. Each one of these individuals represent a life that has been affected by addiction and a testament to what is possible in recovery. And thank you, Premier, for those eloquent and important words about our commitment to bring compassionate intervention to the province of Alberta. And of course, thank you. I see MLA Sear here today supporting us in the announcement. We have Susan and Janelle, two mothers that will be speaking to you shortly about the effect of addiction has had on their family. And Chief Cody Thomas, who's been unwavering in his support for getting recovery to those who suffer within his community across First Nations all across this province. And Dr. Tanguay, of course, for the work he has done leading this province and I think this country in many ways when it comes to addiction treatment and the role he will have with us going forward within compassionate intervention. I'm grateful for all of you for this participation today in the announcement. As we heard from the Premier, today our government is tabling Bill 53, the Compassionate Intervention Act. Since being appointed to the minister responsible for mental health and addiction, I have heard from so many Albertans. I've heard their stories that end with someone finding their way back through treatment into recovery. But in spite of many of them being reunited with their families and getting their life back, I've also heard of other more tragic stories with less happy endings. My heart breaks for families grieving the loss of somebody who has suffered death from addiction. And of course, I stand with all those who family members, parents, and siblings have somebody in addiction right now, where we want to get those family members, those loved community members, into recovery instead of a life of despair and addiction. And that is why we're bringing forward the Compassionate Intervention Act. It is one more tool for our communities to use when they have a loved one suffering from the deadly disease of addiction. We have a thoughtful process, and if passed, it would establish in this act. There are several different aspects of the process, including a Compassionate Intervention Commission, healthcare professionals, police and peace officers, Indigenous leaders, families, and others who would play a role in the compassionate intervention process. Today with us is Dr. Rob Tanguay, a leading expert in psychiatry and addiction medicine within the province and the country. And if the Compassionate Intervention Act is passed, Dr. Tanguay will support its implementation as the medical director. He has been appointed now as the interim senior medical lead for compassionate intervention and will work directly within Recovery Alberta to ensure treatment effectively brings people out of addiction into recovery and renews hope for those family members who are suffering from addiction. The process for compassionate intervention will begin with an application, which can be submitted by a parent, a guardian, a family member, a healthcare professional, a peace or police officer. Once that application is received and subject to the Commission's decision, that Albertan could be given a care plan and required to spend up to 3 months in a secure treatment facility or up to 6 months in community-based treatment facility. Throughout this time, patients will be provided with detox, stabilization, evidence-based medication, group therapy, and psychiatric health care to address the addiction crisis that brought them into compassionate intervention. There would be a focus on one person's individual health and wellness, helping them build recovery capital with their skills and develop the path forward to return to be a mother and a brother and a family member again. Combined, these services provided will support people with greater ability to overcome their addiction and live in long-term recovery. It's important to recognize who this is for as a program. This program is not for the vast majority of Albertans who suffer from addiction. We had one individual in the province of Alberta who overdosed 186 times last year. And the tragic thought is that 187th time not be reversed, but instead be a death. One less community member, one less mother or brother in our families. This program is also not a criminal justice program. This is a healthcare program. I'm a minister of mental health and addiction here, standing before you, where I believe our healthcare should lead to healing and not harming those who suffer from addiction. The addiction that someone may or may not have has no relationship to criminality. Those who suffer from addiction suffer from an illness, and that illness is treatable, and recovery is possible. Not only is it possible, it is probable if we build those pathways. And this Compassionate Intervention Act is just one of the tools and pathways that we will have in the province to help those individuals. For example, that one Albertan who overdosed 186 times, to get an opportunity to have their life returned to them, to be in community again, to be a family member again. As we developed the Compassionate Intervention Act, it became clear to me in my department that everyone involved that there is no direct apples-to-apples comparison with any other jurisdiction with a similar program to what we have here in the province of Alberta. But what we did do is take the best practices from across the world and develop a program that works for Albertans in Alberta. One that protects our rights and freedoms and restores health and safety to our province and to our communities. Jurisdictions like Portugal, Massachusetts, Norway, and Washington State are but a few examples of jurisdictions with some form of mandatory treatment addiction programming. And across every Canadian province and territory, there are various versions of the mental health legislation that also has mandatory treatment for those who are a danger to themselves or others. This piece of legislation of compassionate intervention was developed with the support of leading addiction experts right here at home, like Dr. Tenge and Dr. Day, along with support from experts in well-established institutions, including Harvard, Stanford, and Yale. 6 years ago, Canadians were polled, and 85% put their support behind the idea of addiction treatment that has a compulsory nature if they're a danger to themselves or others. Since then, tragically, our country's addiction crisis has become more public and more grave. It is made clear to me that we need to try something different. What Canadians have been told we need to do by the activist class for the last 25 years hasn't worked. Alberta is leading away with a compassionate and hopeful alternative in the Alberta recovery model and with this legislation today. There are certain activists that will tell us that mandatory treatment is less effective. However, that is not the truth. What we must compare is truly between the options that we have on the table. It is not fair to compare between voluntary and mandatory treatment for those in addiction, but rather the real option on the table is whether or not we should provide addiction treatment for those suffering in that 186 overdose individual in the province, or leave them to live intermittently homeless, subject to physical and sexual violence in so-called drug camps, where individuals do not receive the care that anyone would if their diagnosis was schizophrenia rather than addiction. Recovery is different for every single Albertan. There are many who benefit from connection to the cultural and beliefs and practices, and the Compassionate Intervention Act makes it possible for leadership from an Indigenous community to play an integral part of what the healing process looks like for members of our province, especially those who have an Indigenous background. And I look forward to very closely collaborating with Indigenous partners across this province, whether it be First Nation or Métis, to make sure that they are integral to the process and have ownership over this process when it comes to compassionate intervention along with the province. And this is just one reason of the many why we invested our $182 million to build 5 Indigenous recovery communities, which we use to support those suffering from addiction and potentially those in community compassionate intervention treatment. We of course know youth are especially at risk when it comes to addiction. It has been more and more common to hear of children as young as 12, 13, and 14 years old falling into addiction, often with the hardest drugs that we see in our province. In Alberta, we have had the Protecting Children Abusing Drugs Act for nearly 20 years. And we have heard from parents and professionals both that when it comes to the space of dealing with children in addiction, we must see a change. And we need to have a more than 10-day effectively detox process that PCHAT offers, which is why this act is going to be repealing and replacing Protecting Children Abusing Drugs Act. Will have special considerations for children and families to be involved when someone is suffering from addiction at this tragically young age. Throughout the whole process, personal rights and civil liberties have been essential to how this government has drafted the legislation. I do not believe that our loved ones need to suffer from addiction. And I don't believe it's at all compassionate to have individuals overdosing on a near daily basis on our streets and in our shelters. And we need to consider, when we're balancing this, how we balance civil liberties along with the responsibility we have to that individual's dignity and to the wider consideration of public safety. And I'm happy to say that we have struck that balance with this legislation. This is just one tool that I want to highlight that we've built out in the Alberta recovery model amongst so many that the Premier mentioned when it comes to virtual opioid dependency programs, 11 recovery communities, 10,000 spaces added, our new Northern Alberta Youth Addiction Treatment Centre that has been announced, our 2 compassionate intervention centres, and this is only to name a few, that we are taking incredibly seriously when it comes to addressing this public addiction crisis and caring for those who suffer from addiction. Not by indefinitely facilitating addiction, but instead by providing hopeful recovery, because recovery is not only possible, it's more probable than not if the government and society and our loved ones create pathways to get into recovery for those who suffer from addiction. I want to thank you all for your time, and I want to thank especially our next speaker who's coming up, a mother who has had a tragic story and a circumstance surrounding addiction. Susan, if you're be willing, please come up and share your story with us now.
August 5th, 2015, the day our world turned upside down, the day we began our journey that we'd never imagined, our daughter Ashley's battle with addiction. Addiction is relentless. It doesn't care who you are, where you come from, or how deeply you're loved. It sneaks in, takes hold, and refuses to let go. Ashley was more than her addiction. She was beautiful, inside and out. She had a quick, sarcastic sense of humor that could catch you off guard and make you laugh, even on the hardest days. She had a deep, genuine love for animals, especially horses. Being around them brought her so much peace. It was a part of her soul. In the beginning, we fought with everything we had. We made the calls, we did the research, we almost got her into treatment. But addiction had other plans. No matter what we tried, we couldn't force her to choose recovery, and that realization shattered us. We were powerless. We would have given anything to give her the chance to reclaim her beautiful, vibrant self. Instead, we clung to hope. We prayed, and we found support in Parents Empowering Parents. PEP reminded us that we weren't alone, that there were countless families, other families watching their loved ones slip away, wishing they had the power to save them. Addiction drags people into the darkest, most desperate places, and it affects everyone, those struggling and those who love them. I understand why society fears addiction, but I also know this. Every person in addiction has someone who loves them, someone who would give anything to help. Maybe if the Compassionate Intervention Act had existed then, Ashley would still be here. Maybe it would have given her the chance she needed. Instead, we live with the pain of November 18th, 2021, the day the phone call came, the day everything changed. Ashley will be forever 29. We miss her every single day. We love her endlessly. And we still hold on to hope, not for us, but for every other family walking this painful path. Hope that this small bit of power, the Compassionate Intervention Act, can save someone else's loved one, because no family should ever have to get that phone call.
Hi, Semantu Anuchka Giskak, Chief Cody Thomas. It really hits home. I commend you for all of the people behind us that have struggled with loss, grief. It really hits home. Thank you to the Premier and the Minister for the invitation to be here today. As Chief of Enoch Cree Nation, I speak not only for my own community, but as a father, a son, a witness to the pain that addiction continues to bring to our nations. This crisis has touched every family. We've buried too many young people. We've watched too many parents suffer. And we've struggled with systems that have not always been equipped with the tools of compassion needed to respond. Today's announcement signals a new approach. While no single law or program may solve the opioid crisis, I do believe doing nothing is no longer an option. This legislation will be met with questions, and it should be. There are real concerns about rights, about fairness, and about the long-term success of involuntary care. But when we look at the addiction, I see people who want help. I don't know where to turn. I see families desperate for intervention but forced to wait until tragedy strikes. Drugs are changing, and so must our efforts. What gives me some hope is the government's recognition that any new approach must include First Nation voices, First Nation ways of knowing, and the First Nations-led care. That's not a nice to have, it's a must-have. We need wraparound supports, spiritual, cultural, and medical. We need to treat people not as problems to be solved, but as relatives who need to be brought home. This is not the end of the conversation, it's one step, and we look forward to working with the province over the next several months to ensure that this is done with care, accountability, and most importantly, compassion. I want to give a huge thank you to the province for actually taking the opportunity to find solutions. And as politicians, it's a very tough job, but you guys are actually finding solutions to a lot of the crises that we're facing. And I commend you, Premier and Minister Wilson, and I say a special prayer for all of our relatives, because at the end of the day, we're all human beings, and it hits home so hard that a lot of us as First Nations, it comes with the mental health and the addiction aspect. And hearing a chief say that his niece, 13 years old, is on a highway in psychosis pulling out her hair. And what do? The RCMP show up, and there's nothing that they can do, and they come back to the nations. We're Narcanning them. And it's such a hard reality, and these drugs have evolved, and I really appreciate the opportunity to find solutions, because at the end of the day, it's all our responsibility. It's all of our brothers, sisters, children, cookums, mushrooms. It takes all of us to raise that child. So thank you very much. Akse.
Thank you for joining us. I never do things in 3 minutes, but I'll do my best. I want to thank the Minister and the Premier for their leadership and for their dedication and support to our most vulnerable. People don't choose to suffer from addiction. People don't choose to live without homes. People don't choose to be the most vulnerable of our society. We as a society have chosen to allow it. And under our leadership that we see today, we have chosen to stop it. We have chosen to follow evidence and to do it appropriately. We have chosen to put our most vulnerable first, not last. We have chosen not to walk by, but to stop and intervene compassionately. We will no longer turn a blind eye, and we will no longer ignore it, but put it as first and focused. And I'm honored to be here today. And I understand the privilege, but also the responsibility in front of me. And I am humbled by that. I come to you as a physician and an expert, but also as someone who's lost his brother, who's lost his best friend. And I get it. And that's why I'm here, and that's why I want to be here. Because in my opinion, together, we can and will change everything. And together, we will be what everyone is talking about as the place that changed it all. The world is watching, and we will do it right. We will do it with evidence. We will work with CORE to make sure it's done appropriately and with good data and good outcomes. And we will shift and pivot as we go, but we will put our most vulnerable first. Thank you.
My name is Janelle Watson, and I'm here today from Calgary to share my family's experience with addiction and treatment. I speak about my partner and my 3 children, currently aged 21, 17, and 5 years old. My son Riley is here with me today, and we are so proud that he is 20 months clean and is passionate about his service. He's passionate about his service in the recovery community. I share with you the shocking revelation that it is exceedingly common for kids as young as 12 years old to be using drugs. When I share our ordeal with other families, many naive parents tell me that their child is too busy with activities to use drugs. And my son Riley was one of those kids. He was in a basketball league, advanced in whitewater kayaking, snowboarding, mountain biking. He had a part-time job. He was on the honor roll at school, and he was also one of those kids who started using in junior high. We didn't know the extent of Riley's problems until he endured a drug-induced psychosis at 14 years old. During the episode, he was unable to communicate. He didn't recognize us. He was violent and trying to escape from our home, but he couldn't comprehend how to open the door. It took 5 police officers to physically hold him down until they were able to sedate him and transport him in restraints to the Children's Hospital. Riley was released from the hospital into our care without any support, any resources, or information on available addiction services. We were a family in crisis. It seemed that to Riley, everything was second to his need to procure drugs. We slept with fear, with a chair under the door, frequently waking to the open front door and the camera feed of Riley leaving our house once again. My eldest child spent her time secretly cleaning drugs and paraphernalia from his room, and she was on academic probation at university. We were powerless to control his drug use inside our home. My partner felt so unsafe that he threatened to leave with our toddler, and I feared that I would lose both of my sons. In response to our pressure for addiction treatment, Riley packed his bags and ran away. His return to our home was conditional upon attending treatment. I changed our locks and essentially made my child homeless. In the end, we all make the choices that we can live with. Compassionate intervention is necessary because the burden of those choices is heavy and the consequences are often life or death. Families should not be forced to watch their 14-year-old use deadly drugs with no ability to intervene with meaningful recovery. We shouldn't have to wait for the situation to be so bad that we are making our children homeless to protect other family members from the addiction. I've already foreshadowed the end of our story. Riley's in recovery with 20 months clean and sober, but I worry for other families in crisis trying to help their suffering children. I'm pleased that Alberta is putting more investment into treatment for youth, making legislation to give parents like mine the ability to get their children the help that they need. Increasing capacity for youth treatment will be a lifeline for so many families like mine. Thank you for the opportunity to share my story today. And my final message is to my son, to thank him for choosing recovery every day and to thank the recovery community who welcomes him.
Thank you to all of our speakers, and thank you for sharing your stories there. We're now going to enter the media Q&A portion of this announcement. Just a reminder to our guests in the media that the information shared in this press conference is under embargo until the legislation is tabled later this afternoon. Of course, we'll be taking one question and one follow-up, and we'll be starting off with the mic in the room. Go ahead.
Thanks so much for taking my question. It's Shailan Skolsky with CTV News. For the Premier, the legislation outlines specifically when a patient would be unable to refuse treatment. I'm just wondering from a legal perspective what guidance you received to give you confidence that this would stand up against constitutional challenges, specifically around infringing on people's rights to autonomy and individual decisions around their health.
Well, Dan, I may have you come up and talk about this as well. We've spent a lot of time talking about this, and I think Dan gave the example of the extreme case When we announced that we wanted to go in this direction, I remember there was a young girl who was in recovery who said she wasn't of sound mind. All she cared about was her next fix. And that's what we're aiming to do, is if somebody is not of sound mind, they can't be making a decision of what's best for their own health. If they're overdosing 186 times, if they're endangering other members of the family or the community, those would be the kinds of scenarios that we would imagine that a trusted person in the field would be able to go through the process. We want to make sure that it is done in a considered way, and so Dan can go through and talk about the process that we're going to do there. And there's also a time limit. The time that they spend in treatment is going to be time limited. So I think that we've put forward enough protections to not only be compliant with the Alberta Bill of Rights, but also Section 1 of the Charter of Rights and Freedoms, and it's a new process. So we'll make sure that we're cautious as we go forward, but we also know that this is something that needs to be done.
Thank you. Premier is exactly right. We drafted legislation with the intention of being compliant. We want it to, of course, be constitutional and to balance all the different aspects that we have to deal with. The individuals who we're talking about suffer from the most aggressive form of addiction. And if you look at the legislation, it says that it's effectively a healthcare regime. So our purpose is to treat people. And the legal advice we received, of course, and put into the legislation is that this is about getting people treatment to get them healthy, and that's the heart of what we're doing here. It's not a criminal justice process. I'll also add that we have similar regimes for this sort of treatment in the Mental Health Act within Alberta, but also across every other province and territory in this country. If someone's diagnosed with schizophrenia that causes a psychotic break, then there is the ability to have life-saving pharmaceutical treatment. But if someone's diagnosed with addiction and has a schizophrenic break, then there isn't that until this legislation. So we believe that this is balanced, that this is thoughtful, and this is fundamentally a question that needs to be answered by the public and our legislature that represents the public to say, is there some constitutional right to 187 overdoses causing death on the street and personal carnage within your own life leading to death and public disorder as well? I'd say there's not. But if the opinion of our legislature and the court disagrees, we'll have to address that when it comes there.
And my follow-up, just relating to some of the documents that we received pointed to evidence in other jurisdictions, Portugal, some U.S. states that have similar models. But we also heard several times that no other jurisdiction mirrors what we are doing here in Alberta. So I'm wondering what evidence, studies, specific data you're looking at that makes you believe that this will be effective, and what metrics you'll be using to determine that it is in fact working.
I almost feel like I should invite Dr. Voss up here. I know that there's been a lot of work done with young people in the Adolescent Recovery Center. And we established CORE, which is our entity that is going to be developing and doing the research base so that we can prove it out. I mean, you won't know if something works until you try it, and you won't know what your success rate is until you try it. You won't know what your recidivism rate is until you try it. But we don't give up on people. We've got lots of procedures that we try in hospital. They might not work the first time around, so we go and try something new. So that's what we're trying. We have tried a number of things. We have tried the virtual opioid dependency program, which gives people Suboxone and Sublocade. We have tried the therapeutic living units in corrections facilities. We have tried the recovery communities. And so this is just one additional aspect of what we're going to try. And we have established the framework. So a lot of data will be available, and we'll do the analysis to see what works. And if we need to try something new, we will try something new.
Could I
Yeah, please.
Thank you. And in addition to that, there's a recent publication, the Canadian Journal of Addiction Medicine, that shows there's no evidence to indicate that this won't work when it comes to addiction treatment. What we look at as the most positive outcomes when it comes to addiction is often found in safety-sensitive industries. So, for example, the airline industry and looking at the medical industry for those who are physicians, for example, where there's the threat of mandatory treatment or losing your license, your ability to provide for your family, a huge personal cost. And so I'd say every kind of interventions come in all shapes and sizes. Often the criminal justice program, when it comes to drug treatment courts and conditions of bail, et cetera, will have versions of mandatory treatment. We're taking it out of a criminal justice and out of an industry base and saying that this is about healthcare and it needs to be centered around healing.
And we'll go to our next at the mic.
Hi, Sean Amato with City News. Premier, yours is a personal choice government, so much so that some of your ministers, some of your members won't even recommend vaccines to people, even though we have a measles outbreak in Alberta right now. So what would you say to critics who say that this is hypocritical and this is not based in personal choice to force people to get treatment?
Well, first of all, I'd say that we have near 90% take up of the MMR vaccine. We have had an outbreak, and fortunately, most of the kids have recovered. So I think we had 74 cases, and I think 68 are no longer active. So we continue to do public service announcements to let people know. You can call 811 if you're unvaccinated and want to make sure that if there's an outbreak in your community, you're protected. So we'll put that aside as an issue. The second thing I'd say is when we were drafting our Alberta Bill of Rights, we made it clear in the language that you have to be of sound mind. A person who is out of their mind with addiction, overdosing 186 times in a year, is not of sound mind. And we believe that we as a community shouldn't be watching people slowly kill themselves on the street. So that's where I think we draw the line, is if you're of sound mind, able to make your own independent decisions, you have the right to choose your medical intervention. If you're causing harm to yourself or others, then we're going to try this different pathway.
Thanks. On a different topic, yesterday, UCP MLA Peter Guthrie voted for a public inquiry into health allegations. What is your response to that? He also said that he's being gagged by your government during the suspension he's under. What is your response to MLA Guthrie, and will he be removed from your caucus?
Well, yeah, I'm not sure what he's referring to. He was asked if he wanted to go into the question period rotation, and he declined. So you'll have to find out why he made that statement. But it's most of my caucus, as I've said from the beginning, are prepared to let the two processes play out. We have a process that is involving an independent retired judge, Justice Wyant, and another independent process involving the Auditor General. And I think the vast majority of my caucus, nearly all, are waiting to see the results of that. So we want to see if there's any evidence of wrongdoing, and then once those reports are out, we'll make a judgment at that time.
Thanks, Sean.
The
And we're
question
going
was,
to
should he be
take
removed
one more
from
question
office?
from the floor before going to the phone.
That's a caucus decision. We don't talk about internal caucus matters here.
Hi, James from the Western Standard. Thanks for taking my question. For Minister Williams, I'm wondering if you can compare this act with what's going on in BC right now in terms of their harm reduction policies.
Well, I think harm reduction started off as a well-intended initiative to say that if people are going to be using, we should reduce the harm that happens. This started with initiatives like needle exchanges, needle cleanup, et cetera, things that we support here in the province. Some people consider naloxone harm reduction. I kind of don't care to give it a label. I want to see people get healthy through addiction. But over the last 25 years, Canada has seen this dramatic shift where the activist class and the so-called experts from community colleges have told us that we need to endanger our communities and forgo the dignity of the loved ones in order to be caring to those who have addiction. And it stopped being about reducing harm, and you accidentally ended up producing the harm itself when you had unsafe supply to the tune of $100 million of hydromorphone, which is 5 times more powerful than heroin, mass distributed, unwitnessed, passed into our communities with mass diversion happening as, quote, commonplace, according to the Chief Medical Officer of Health in British Columbia. That, by comparison to what Alberta has said, as our fundamental assumption is that every single Albertan has inherent dignity, we should care for them, and that there's this lie we've been told about choosing between caring about those in addiction and having safe communities, caring for those in addiction compassionately, and respecting that individual by getting them treatment and healthcare. Alberta has rejected the false assumption that BC has gone all the way into. I mean, drug consumption sites on every street corner, unsafe supply with next to no evidence for it, increasingly more evidence showing its diversion and damage to community, decriminalization, making its way all the way into our hospitals, which should be places of healing where nurses were afraid of inhaling secondhand crystal meth smoke with no consequences for those who are using, and threat of physical harassment constantly by those who are suffering from addiction. And when they go to that hospital in British Columbia, what did they get? More drugs, more encouragement, more facilitation. Alberta has shown a different approach. This is one tool in that toolkit. We see British Columbia's NDP, even in their last general election, has some form of compassion intervention. Though theirs used as a criminal justice facility, ours do not, because ours is fundamentally a healthcare process. And we're happily, with our Alberta recovery model, seeing a decrease, a 37% decrease in opioid overdose deaths. That's a 3 times greater decrease than they've seen in British Columbia. And I'm optimistic that that's going to continue.
And we're going to go to the phones now for a few questions. Operator, could you put through our first caller, please?
Janet French with CBC Edmonton. Hi there, thanks for taking my question. So I was talking to some psychiatrists who told me that it's the really sick people who would be qualifying for this kind of proposed treatment would be the least likely physiologically to respond to this kind of treatment. So I'm wondering, what would you say to convince someone that this exercise is based on evidence rather than a political show of trying to show that you're doing something to help people?
Well, it's definitely based on evidence. We've compiled as much data as we can. We had our expert recovery advisory panel chaired by Dr. Keith Humphreys out of Stanford, who authored the Stanford Lancet Commission, who has endorsed the program as well. But I think what I'll do when it comes to speaking with authority, I'll ask Dr. Tange to come up and talk about, from a physiological and psychiatry perspective, who is accessible to addiction recovery, and what this regime has as a consequence.
Thank you, Minister. To be clear, I'd be happy to talk to those psychiatrists anytime. The reality is not intervening is not going to lead to any benefit. Intervening in our most unwell and our most vulnerable and our most suffering individuals is really the only way to do it. Now, we talk about the data and the evidence. The data does not say that it will not work. There is no data that would confirm that it would not work. I was one of the authors of the study that was mentioned. The data clearly shows in cases of multidisciplinary treatment, which is what we will be doing here in Alberta, is that individuals who are involuntarily treated often are equal in outcomes to those who are voluntary, and if not, show improvement, but maybe not to the same extent as those who are voluntary. So at the end of the day, this is about science and evidence and following suit with making sure that we work with CORE to get the good data and outcomes that we're looking for and pivot as we go. But there is nothing in there that would suggest that we'll make things worse. Thanks.
And I might just add that we have had some success with our therapeutic living units. We've got, in our corrections facilities, we've got special floors where people can go through a recovery program. And Dan may correct me if I've got the data wrong, but with a year under our belt, we saw that it reduced the number of deaths from opioid overdose after release by 51%. And so that's an incarcerated environment. It is the individuals do ask to be part of the program. But I think that the long-term approach that we've taken there, we're very encouraged that that might give an early indication that an individual's brain can heal over a period of time and allow them to have the perspective so that they can make choices to stay clean. Did you want to comment on that, Dan?
I think that's great.
And a follow-up, Janet?
Yeah, I'm just thinking about the ethical considerations of this. If you're looking at a different scenario where there's a religious family with a child who they're going to refuse a blood transfusion to save a life, for treatment of cancer or something like that, would you be willing to force somebody in that scenario into forced treatment because it would save their life? And if not, how is the scenario different?
Well, the courts have determined that a mature minor can make that decision, I believe, at the age of 15 or 16. So I think that there's some jurisprudence around the instance of an individual when they get an opportunity to make the choice to end their life. This is not to end life, this is to sustain life. We're taking a choice that will make sure that people aren't down a pathway of ultimately dying on the street or in terrible circumstances, and we think it's worth giving it a try.
Thank you. Operator, could you put through our next caller, please?
Kevin Orlan with Bloomberg News.
Hello, and thank you for taking my question. Sorry to switch topics a little bit here, but my question is for Premier Smith. With Canada seeking to decrease its economic dependence on the U.S., how much leverage do you think Alberta will have with Ottawa in the months and years ahead, regardless of who wins the federal election this month?
I think Canada as a whole has a lot of leverage, because whether it's oil and gas, or whether it's electricity, or whether it's critical minerals, or whether it's potash, or whether it's uranium, or whether it's food, whether it's intermediate products, I think we've been able to make the case that Canada and the U.S. enjoy a special relationship that leads to benefits for both nations. I think it's part of the reason why we have, for the time being, some respect for those products that are compliant with the Canada-U.S. Free Trade Agreement, and a commitment, it looks like, from the United States to accelerate the negotiations around that rather than wait until 2026. So I'm hopeful that spirit of cooperation will extend regardless of who ends up winning on April 28th.
And just to follow up on that, I mean, there's a lot of policy objectives that Alberta has that it wants the next government to address. I guess, how much do you think the economic situation Canada is in strengthens Alberta's hand in trying to get those federal policy changes through?
I've been, every time I've given a presentation, been in a meeting, talked to media, I talk about all of the things that Canada has to offer, full stop, because all of the things that all of my colleagues in other provinces have to offer are all the things that we have to offer in Alberta. So I would say that every single province has taken the approach of working their contacts, making that case, and trying to have influence on the administration. And even though there's some work to do, obviously, on steel and aluminum, auto parts and timber, we seem to have been able to get the administration to respect the Canada-U.S. Free Trade Agreement and the compliant goods in it until such time as we can renegotiate. And that's been an all-of-government cross-Canada approach that I think has been successful because we've been able to make the economic arguments.
Thank you, Kevin. And we have time for 2 more questions. Operator, could you put through our next caller, and then we'll come back to the room.
Rick Bell with Host Media.
It's 12 noon, so I'll say good afternoon, Premier. A week ago in Calgary, in person, at the Liberal rally, or actually not at the Liberal rally, a press conference following the Liberal rally, Mark Carney was asked by myself, explicitly, directly, point blank, when he talks about building big projects in Canada, whether he could make a commitment that among those big projects would be oil and gas pipelines, LNG projects. He did not, I repeat, did not make that commitment. Then this week, he is asked about pipelines again, and he is now even less supportive, talking about not necessarily, maybe, we'll see. And so what is your reaction to the fact that it feels like Groundhog Day, that we're going through the same routine as was happening when Justin Trudeau was the Prime Minister? So what can you say about the fact that the Liberal leader, currently leading in the polls, seems to be very non-committal, and we know what that means, about energy projects?
Well, I would say that we have to look at the record. We've got some politicians out there campaigning who've been saying the same thing consistently, month after month, year after year. And we have another politician who says different things in French and English, different things in one part of the country versus another, and different things at the beginning of a campaign versus partway through it. So I think that it is a question of credibility. It's part of the reason why I put the 9 items on the table that we need to see repealed in order to reset the relationship with Alberta. Because if you're not prepared to honor and respect provincial rights to develop their resources, if you're not going to repeal a tanker ban, if you're not going to repeal net zero power regs, net zero vehicle regs, net zero car regs, or net zero housing regs, then you're not really serious about developing our country into an economic powerhouse. So that's up to Albertans and Canadians to decide. I've made my choice. I don't think people will be surprised who I'm voting for, but I think that is a demonstration of why it is we're having a very contested election right now. We have to make a judgment about who has credibility on these files.
And my second question is a poll that came out yesterday. I've just actually seen it just an hour ago. People being polled or asked the question, do you think talk of Western separatist movements in provinces like Alberta and Saskatchewan should be taken seriously? And these are people polled coast to coast to coast. And the majority of people in this Nanos poll, published in the Globe and Mail, say, yeah. Almost 2 out of 3 say this kind of talk must be taken seriously. What is your reaction to that? Because this whole idea of talk of Western separatism or Alberta separatism or whatever keeps creeping in and out during this campaign.
I was just in Montreal, meeting with not only the business community, but also a member of the government. And I think that there's a solution here to those kind of sentiments, whether they're in the West or whether they're in Quebec. And the solution is to honor and respect the Constitution and honor and respect provincial jurisdiction and allow for autonomy, allow for Quebec to develop policies that make sense for Quebec and allow Alberta to develop policies that make sense for Alberta. So that the pathway is there to bring the temperature down, but the question will be whether there's a will and a partner in the federal government after we see the vote on April the 28th. I'll still be asking for the same things I've been asking for the last 2.5 years, unsuccessfully with the current government. And I haven't gotten any commitments on those 9 things that I put on the table from the current Prime Minister. But I will be asking for them again, and we'll have to make a judgment at that time. But I think you're seeing that it's not just Alberta. Saskatchewan's upset. Quebec is upset. I think that you'll hear from other provinces. They're also frustrated at the level of interference in provincial jurisdiction. So I think that there may be a coalition of provinces that may finally get this country working the way it was always intended to. That's what I'll be working towards.
Thank you. And we have time for one more question. We'll go to the mic here in the room.
For Minister Williams, please, back on topic. I'm just wondering how many times an individual could go through this process. Is there a limit?
No, this is a healthcare process, so it's not as though it has some sort of criminal justice limitation, et cetera. So if somebody is a danger to themselves or others as a result of their serious addiction issue, then there's a possibility of being readmitted if you meet that standard, and then treatment would follow.
And Susan and Janelle, may I ask you guys a question as well? Thank you both for sharing your story. I'm sure you're aware there are criticisms to this model, so I'm just wondering if you could speak, from 2 folks who have lived this experience, what specifically in the government's proposed legislation felt right, felt like the next step for your family, felt humane for your family?
I can take it. I think that it's the opportunity for long-term care, because some of the facilities that are available that I looked into when my son was going through treatment were short-term. And I had watched him detox numerous times and knew that the length of time wasn't enough. And so to be able to have them go through detox into long-term care, to make relationships, to change the relationships with people that they currently have, is more meaningful for a long-term recovery. And that's where I think the success in this would lie.
I agree with everything Janelle said. I think it's just a question of hope and keeping that hope, because when you have a loved one in addiction, you have no control, you have no power over getting them into any kind of recovery or treatment. So I think with the Compassionate Care Intervention Act, there's that hope that you can get your loved one back. Hope is always the biggest thing when you have somebody in addiction is, you just want that person back. Addiction doesn't define them, but, it's just a hope that they can get that recovery, all of the tools, as Janelle said, the relationships needed for long-term recovery and a life again.
Thank you so much. And that'll conclude today's press conference. Thank you again to our guests and all of our speakers here today. We're just going to take a quick group photo here now.